to you about an amazing scheme that they've, the Wellbeing Charter, and I won't talk too much about it because they're obviously going to present it. They've got a lot of really exciting information of how you can get involved in that in order to better to improve your wellbeing strategies, but also to celebrate what you're already doing and to make sure that you shout about it and everyone knows about it. We then have a peer speaker, so where we have Anushka Kamali, who's from 360 Degrees Healthcare, from up north somewhere. I'm sorry, Anushka, I can't quite remember where you're based. But Anushka and her colleagues have introduced some amazing wellbeing strategies throughout the coronavirus pandemic, and I wanted her to come along to chat about those because she has been delivering them. She's on top of everything else that's been happening, and she's found some really amazing simple ways to support staff. So I'm really excited to hear what she has to say, and there'll be lots of opportunities for you to ask questions because I'm sure you'll really want to find out a little bit more about what her and her team have been doing. We then have Matt Errington, and apologies, I did update these slides and they seem to have deleted my updates, but we have Matt Errington and Juliet Green from Skills for Care, who are going to give you some wellbeing news related to some of the resources and work that Skills for Care are doing on the topic of staff wellbeing. So we're really excited to have them here. They've got some really good information and resources to share with you. We'll then have a Q&A panel, and like I said, we'll be really encouraging you to ask questions. Don't wait until the Q&A panel to put questions in the chat, put them in, and then we can always go back through and find them. So as and when you think of them, just put them in the chat. If there are any questions that we don't know the answers to immediately today, we can always go away and come back to you with those. So just any questions that you have, put them into the chat, and then Olivia will be doing some exciting updates at the end, and like I said, there is one particular update that I'm really excited that we'll be talking about. So how to participate. So hopefully you guys got my email, but we're going to be using a tool called Mentimeter. For those of you that have been to our face-to-face events, you'll hopefully have used this before. It's a really cool app which basically allows you to answer poll questions, and then we'll all be able to see the results on the screen. It's anonymous, so you don't need to feel worried about, you can be honest on there. Hopefully you all got that link, but if not, don't worry, we will explain it, but you just need to go to www.mentimeter.com, and then I'll give you a code that you will put into your phone. So hopefully that'll work well. If you don't want to, or you're not able to use Mentimeter for whatever reason, you can still take part. Just use the chat on Microsoft Teams, so you'll be able to answer the questions whether you use Mentimeter or not. But I really want you to give it a go because it's just quite a cool piece of software that we use. So while people are talking, we do ask that you just keep your mics muted. That's not because we don't want to hear you talk, because obviously, we really want to hear what you have to say, but Microsoft Teams is a bit quirky and it can really disrupt sound. And it can be something as simple as like a shuffling of a paper, and it can really throw the microphones off. It's hard for people to hear. So while we have a presenter speaking, unless they directly ask for people to unmute and speak, just keep your microphone muted. But like we said, please don't feel like you can't keep chatting and engaging. Just use the chat function to share your experiences or to ask questions. So like I said, we want to celebrate and talk about some of the amazing strategies that you've already implemented. I've got a few photos here of some of our members and what they've been getting up to over the last sort of 6 to 8 months to support their staff and to promote well-being. It's a good example, Callum.
Hello.
Hiya. I'm just going to mute your microphone. It's okay. So we've got some good examples here. This is just a fraction of them. I just pulled out some of the ones that I knew of to put on here. But what I'd really love for you to do is to just put what things you've already been doing to help your workforce with their well-being. Share some of the things that have worked well, maybe things that you've tried and haven't worked as well. So again, just put that in the chat box because we really want to share and celebrate all the different things that you've been doing already. So I'm now going to hand over to Ali and Bryony if they're ready for me to do so. Hopefully they are. Ali, if you just let me know when to click through to next slide, and we'll go from there. Okay. I will mute my microphone though, so I'm not disrupting the sound.
Thanks for the intro, Lauren, and thanks to everyone for inviting us to be part of the digital conference this morning. As we all know, it's been a strange year for everyone. Work lives and personal lives have been affected for us, our work colleagues, and the people that receive our care. And we all had concerns about health and wellbeing prior to March. So I think the situation's amplified, and we wanted to spend this morning talking through a manageable process that we think could really help you and your colleagues raise the profile of health and wellbeing in a straightforward way. So I don't know where the slides are. Let's see.
I'm having a slight technical, but we're going to handle this smoothly, Ali, by
restart. I'll
carry on
freestyle
talking, and then it will seamlessly arrive, and no one will notice that anything's happening.
Okay, so we've got, I think, about half an hour or so that we were going to touch on this morning, which means that we can't do a deep dive into everything, but we're going to have a look at the overall situation around sort of health and wellbeing in the workplace. We're going to talk through a process, a step-by-step process that's already ready for you to be part of if you would like to. We've got a pledge process, which is part of a Wellbeing at Work charter, and we're going to hear about how that could help you workforce implement health and wellbeing. We're going to hear some examples of how other workplaces have implemented things. Although I want you to sit back and listen, you will be asked different questions during the session. We're going to use the Mentimeter to capture your feedback, and it's quite actively, hopefully, thought-provoking. So we're going to go blind and and run with it. So I think, is the first question in the Mentimeter, Lauren, or are we in the chat? I think to run smoothly, we were going to ask, what is the approximate number of employees in your organisation? If you can just pop that in the chat, that would be really helpful. Brilliant, that means that you can hear me. So thank you for who's put that in, that's really helpful. So then we can guide the conversation along that accordingly. Fabulous. Okay, so I'll let those numbers keep coming, and that's really, really helpful.
I'm really sorry, guys. My entire system seems to be crashing, but that's absolutely fine. If you carry on, Ali, I will try and get the slides up as soon as possible. Apologies about this.
I'm just looking at presenting the slides as well, Lauren. Just bear with me.
Oh, thank you. It's all good fun.
Part of it.
It is, yeah.
So depending on the size of your organisation, probably also tells us how differently everybody's communicating and different things that you're going to need. The package that we're going to go through and the conversation this morning is relevant to everybody, but your thought process as we go through the session, I hope, prompts how you might implement some of the things. Hey, it looks like we have slides. So I think we'll head to slide 11, if that's okay. Lauren, looking at where you've got on the screen.
I think it's Olivia in control. That's fine.
Brilliant. So what I wanted to do is pose a question to the group. I think it was slide 11, if that's okay. A question: on a scale of 1 to 10, how much of a challenge is health and wellbeing, physical and mental health, an issue for your workforce? This particular one. Brilliant. Thank you very much, whoever's doing the screen. And I think, is that in the Mentimeter, Lauren, or is that in the chat?
No, it is in Mentimeter, so I'll just request control and I'll just get Mentimeter up, and we will do it on there.
Brilliant. So 0 is, or 1 would be low, a small challenge, and 10 would be a big challenge for your workforce as you see it at the moment. And this is just a thought process for you and a gauge for us.
So hopefully everyone can see this now. Fingers crossed. Can you all see on the screen? So it says, what is the approximate number of employees? Yeah, I think we've done that one. So
yeah, we've done that one. So skip that one because we've got some good numbers come through from the group.
What everyone needs to do is on the app, if you type in the code 6321435, so either on your laptop or on your phone, wherever you've should give you a scale so that you can then pick between 1 and 10, 1 being it's not a challenge at all, and then you should be able to pick up to 10. The line then gives us an average of what people are saying.
They're still coming through, I think, aren't they, Lauren?
Still moving a little bit. I think we've kind of seemed to have settled around 6.5.
Okay, so this is just it's a reflective question, if you like, really. That's not a right or wrong answer, but it's important to understand how you feel and if there is a challenge for health and well-being in your workforce. So that's where we'll leave that. So at 6.5. And on a scale of 1 to 10, at this current moment in time, how well equipped do you think your managers and teams are to support this? To support improving health and well-being, shall we say? Okay, so we're right in the middle on a 5-ish.
Yeah.
That's really helpful. Thank you, everybody, for sharing that. I think it's really important that we don't think we've got to fix the problem. I think if we go back to the slides, Lauren, if that's okay. Yeah. There's a quote on there. It's about you don't have to try to take on or solve all the issues that people might present themselves with, but just know that a wellbeing conversation and or a change in workforce culture can be part of the solution. And it's about where to go for help and perhaps really opening the doors for those conversations. So the benefits, the personal and financial benefits of improved workplace health were well documented prior to the COVID situation. Now in the current climate, individuals and organisations have a renewed appetite to look at physical, social and emotional well-being to prevent short-term ill health or ill health in the short term, but also longer term. And it's really important that employees feel supported to look after their own health and well-being, and particularly in the care sector as they're looking after other people's health and well-being. I wanted to point out that we're talking about employees, but we're also talking about your managers as well. It's been a big 8 months and there's some big tasks and speed of change has been really tricky for everyone. So we really need to think about how we're supporting people. What we wanted to do is just start with some data on health and well-being, and then we're going to look at how we can do some support work. So here on this slide is, why is it important? Why should we be looking at it? Up there on the top left-hand side, we've got 9.1 million workers were suffering from work-related ill health, costing the UK economy 9.8 billion. That's from 2018 to 2019. Looking at the data we've got for through Skills for Care, in Leicestershire, approximately 72,000 days were lost due to sickness in 2019-2020. That was an average of 5 sick days per person. And in Leicester, it was a total of 40,000 with an average of 3.5 days per person. So if we can improve that at all, that would make people's lives better, but also help your organisations as well. We know that unhealthy lifestyles and behaviours and results and chronic disease symptoms can have adverse effects on people's ability to work. We know that the social care sector in Leicester and Leicestershire employs around 28,000 people. If we're looking at that, we really need to think about how we can support people to have improved health and well-being. We're at work a long time in our lives, so it's worth us having a healthy opportunity while we're there. One of the interesting bits of data is that in the middle here, 25% of people's time, if they work full time, is spent at work. But if you actually take off the time for sleep each day, that would leave a third of our awake hours are actually at work. So there really is an opportunity to capture people's sort of hearts and minds and create a culture that works for well-being. Can you switch to the next slide for me? Brilliant. I think Bryony's going to talk a little bit more about this one.
Yeah, so just looking sort of more specifically at the care sector, a new report was published by the Care Workers Charity pre the COVID pandemic, and it took a more detailed look at sort of the issues affecting care workers specifically, and it also tried to identify sort of the positive and achievable steps that employers could take to overcome many of these challenges. So just picking up some of those numbers that Ali's already mentioned already, but there was 39,000 different establishments providing care across England, obviously a huge workforce and opportunity there for us to support a huge number of employees to better their health. Specifically when the research, registered managers and senior leaders were interviewed to find out their three main staffing concerns, and mental well-being was at the very top of that. And it was suggested in the report that care workers may be at a higher risk of mental health issues because of the demands of their role and the increased tendency for empathy as well. According to the Health and Safety Executive, the health and social care sector have the second highest rate, of stress, depression and anxiety, following the education sector, and other issues have been highlighted as well in that report. So recruiting new care staff taking sick leave, and trying to retain care staff as well. On the left there, you can see that 51% of care workers have considered leaving their role because of the effect of the job on their mental health. So there's a huge opportunity here for us to support wellbeing and make a big improvement to some of these issues. Specifically, we're looking at the average number of sick days per person working in social care, about 25% above the UK average. And a massive issue as well is presenteeism. So the report showed that 19% of employees were going into work despite feeling unwell, and that was on more than one day a week. And presenteeism has a huge impact on, efficiency of work, the chance of making mistakes, low morale, and longer recovery times for that individual's health as well. If we go to the next slide, please. So obviously COVID-19 has happened, and that's had a big impact on some of those challenges that the sector was probably already facing. So it's likely that some of those problems and challenges have been exacerbated by the pandemic. So this slide just shows some of the key headlines from a report from the government in May of this year, and it highlighted the impact that looking after staff wellbeing can have on the experience and health outcomes of people that actually receive care and support from those care workers. And they also identified some of those challenges that are facing the sector, particularly over the last few months, and how that can impact on staff wellbeing. So they highlighted that anxiety is probably heightened, particularly for those that are home to high-risk dependents, and the impact of working on the front line. Staff shortages and absences are increasing pressure, particularly with a self-isolation and as people go off for 2 weeks at a time. Feelings of isolation as a result of social distancing measures, especially for people that are working on their own anyway, and the impact of trying to help employees to maintain resilience and actually be able to cope and deal with these pressures, and in turn support their mental well-being and protect it in the long run. So looking after the health and wellbeing of staff has always been important, but with the challenges that we face this year in your sector and across all sectors, we think it's more important than ever that employees feel supported to look after their health and wellbeing at work. Healthier staff equals healthier outcomes for the people that receive care and support from you, and hopefully in the long run we'll see impacts on the organisation as well, and improved productivity, higher staff morale, and reduced sickness absence too. Go on to the next slide, thank you. So these are just some general benefits of workforce health and having a healthy workforce, and they cover sort of an individual level and an organisation level as well. So on the individual level, by providing support for staff to look after their health and well-being, you can reduce the risk to health and improve their current health status, so reduce the risk of developing long-term health conditions. We see a reduction in stress levels, greater job and wider life satisfaction, an improved sense of well-being, and that encompasses physical, mental and social health. And they're also more likely to develop healthy habits that they share with their families and their friends, and they're the healthy workers of the future. So we want to instill those habits long term. On the organisational level, sort of by investing time and capacity into employees, in turn, we'll sort of see reduced costs associated with sickness absence, improved recruitment and retention, re-energised culture and team morale, and a more positive image for the company, which really helps when you're trying to attract people to work for your company. Quality of care, again, is also more likely to be improved if people are looking after themselves better. So in the long run, it's sort of a whole system benefit, so to the individual and to the organisation. I think we're back to Ali now.
Brilliant, thanks, Bryony. So how do we help you with this journey? Can you flip to the next slide, Lauren? Brilliant. So we've got a process. It's already set up and ready to go. It's a 3-step process which starts with a pledge. You'd be pledging your commitment to employee health and well-being. We'd be hoping to improve healthy behaviours, productivity, and explore the workforce culture. Can you flip on to the next? Brilliant. So we said it starts with a pledge, and what does that really mean? You know, in reality, what does that mean? So there's some easy steps. So the first step that you would be taking is you would be appointing a dedicated health and wellbeing coordinator. Now, quite often there's somebody partially doing some of that already, or that you think it might align with, but that's just thinking about who that person might be. If you're running some of the larger organisations who posted the numbers earlier, you might have several. We would want you to demonstrate management buy-in and commit to supporting employees' health and wellbeing, and that might be a decision that's made by you and colleagues on a team, or it might be made by other people in your organisation. So I think Lauren's already said the slides will be shared, and we'll happily help with that. We're going to explore a bit of that later. The third thing would be that you'd be pledging to promote public health messages and encourage healthy lifestyles. And the fourth thing would be to make the most of the free resources that are available. So we think that's quite straightforward, but they are important steps because you need people in the roles to agree and sign in and buy into the concept that we're moving forwards with. And if everybody signed up today, that would be amazing. But if everybody signed up in 2 or 3 weeks' time after having some really big, meaningful conversations, that would probably be far more valuable. So if we skip down to the next slide, after signing the pledge, what does that mean? You know, this is the pledge is totally free. You would just receive confirmation that you've been approved and that you can access the range of resources that are available. You get a full range of information, useful links and prepared information that be ready to share. The topics and support information would include sleep, stress, and physical activity, active travel, alcohol consumption, smoking cessation. There's some of them. There will be others, but they'd be the ones that we'd be ready to go with first. And have been tried and tested by other organisations. We've also got some campaign resources which include Better Health, which you've probably seen recently, which is a Public Health England campaign. There's a 1U campaign, tailored and driven by evidence and brilliant ways of opening questions and thought processes for people to explore how they feel about their health. As Active Together, which is our local campaign that we're working on for people to be active in their way and their space. And it's current as well. We've got the This Girl Can, and we're Undefeatable, which hopefully you might have seen elsewhere as well, but we can help you tailor that and share it amongst your workforce. So the pledge is the very first step on this journey. The ideal scenario would be that you progress on to achieve the award, and by doing that you'd complete what we call a workplace health needs assessment. But they are optional. This is an optional process. The pledge is totally free. But Bryony's going to actually explain to you a little bit more about the workplace health needs analysis and how that might really help you really make big steps on this.
Yeah, so we've been supporting workplaces for the last few years to complete the Workplace Health Needs Assessment, and this is a tested tool that was developed by Public Health England back in 2017, and its main aim is to help employers identify the key priority areas of staff health and wellbeing. So we know that it can be really hard to know where to start when it comes to support and wellbeing, gaining a bit of an understanding of employee needs, where there might be some priority areas, especially for those with much larger numbers of staff. It can help you to sort of really pinpoint where you can best support staff and what interventions and activities will be received well. So it's a really simple process, and talk through the 3 steps now. But step 1, we ask your employees to complete a workplace health needs assessment. It takes around 10 to 15 minutes to complete. We set it up on our website, and you just simply share the link with staff. So all you need to do from that point is to share the link with staff and do your best to encourage them to complete it. It covers health and wellbeing in quite a broad sense. So it such as physical activity, smoking, mental health, alcohol, and sleep, but it also looks into some areas around workplace culture, how line managers feel in terms of promoting positive health and wellbeing practices. So it really gives a deep dive into the health and wellbeing of your workforce. Once those results are collated, and that normally takes around 4 weeks, we'll produce a full analysis of all of the data and produce a comprehensive report for you. This is complete with sort of tailored recommendations that provide you with local and national opportunities to support your staff with any issues identified. And then step 3, we'll come back to you and we'll support you to go through that report and produce eventually a health and wellbeing action plan or strategy that addresses these issues and helps to identify next steps and actions moving forward. Just a note that I think it allows you to provide an offer that's bespoke to your employees' needs. And I think spending time on the right things for your team means you're investing to achieve specific outcomes. So hopefully the report gives you enough detail to be able to sort of make that start, particularly if this is new to you, or you've got a new turnaround of staff and you're looking at how you can best support the needs of those. And the only work for you involved in this simply sharing the link, encouraging that good response, and then working with us through the results once you've received your report. So you then have the option of signing up to the award, and completing the needs assessment is one criteria of the award that is ticked off already. The award is the next step to the pledge, so we want you to be able to demonstrate implementation of the pledge and provide evidence of the delivery of health and wellbeing interventions, and these might be mental health and wellbeing strategies, travel plans, exercise classes for staff, whatever comes out of that needs assessment and you think is right organisation. So pricing starts from £100, and Ali's going to talk through that on the next slide, but the simple criteria for the award is to complete the needs assessment, have that consultation session with us to go through that report and identify your next steps, submit a health and wellbeing action plan, and we've got a template you can use for that, so you're not starting from a blank sheet of paper. And then evidence the delivery of interventions, and that might be over a 12-24 month period, but it's setting up those activities and those interventions that will help to identify some of those issues raised within the report. Okay. So this we'll share all the resources with you at the end of the workshop, but this slide just shows you what you get for each level of accreditation. So you can see over on the left, or for all of the accreditations, you get access to our resource library. You'll get a badge and certificate to sort of recognise your commitment, and access to our wider support package too. Okay, thank you.
Okay, so we just wanted to explain the cost a bit more, because obviously that's a question that's come up on the chat as well. The pledge is totally free, regardless of where you are, and the whole award would cost, the full award for public sector and charities would be £100, for small to medium sized enterprises would be £200, and for larger enterprises that would be £300. And if you were to complete the workplace health needs assessment with us, that the contribution for that would be part of that award. So that's the total figure that I've just given you there. If you wanted to do it in a stepping stone process, and your next step after the pledge is the workplace health needs assessment, which is quite light, and the costs on the bottom half of this slide would apply. So if you're public sector or charities, that would be free. If you're small to medium sized enterprises, that's less than 250 employees, which I'll come back to in a moment, would be £100. And for larger enterprises, it would be £200. So I hope, so the first step would be the pledge. The second step would be the assessment. And then the third step would be the award. But the award costs on there is the total cost for you. I think one of the questions that came up in a conversation I had earlier with Olivia actually was what happens when you've got a larger employer, perhaps on a national scale, but the workforce is in Leicester or Leicestershire. Just to be clear, this programme by Public Health and the local authorities in Leicester and Leicestershire, and they would have an interest in the residents and workers in Leicester and Leicestershire. So if you're looking to do this for employees based in Leicester and Leicestershire and you've got less than 250, we could explore whether we put that through a small to medium sized enterprise. But equally, when you look at the next step up for a larger enterprise to run it nationally, that is something that we've done for other organisations in other sectors and been hugely valuable. And actually by somebody else doing the legwork on the survey, the action planning and the development of all the information, that really helps inform management decisions. So a lot less time for everyone. I think Bryony is responding to a question around OB and Wixon, so I'll let that one come up. So just to be clear, this process works, but it isn't going to be an overnight. You know, if everybody pledged today and went for the award tomorrow, we would expect that they've probably been embarking on this journey for some time. So the conversation at the moment would be around the pledge and then potentially moving towards the needs assessment. And then we'll be working with you as individuals, because you'll be part of the programme, to see whether you're ready and keen and able to go for the award and how that works. So it's about us working together really to support you. And the other point is I wanted to sort of just come up. Could you just go back one slide for me? Sorry, Lauren. Thanks. Would be just to take a moment now on what savings could this type of work actually make for you. Would there be reductions in staff sickness levels? Would there be reductions in recruitment? Would there be reductions in the need to keep retraining staff? Would it enable people to feel more connected with their colleagues? And would it improve the care people are receiving? It's just thoughts really, but effectively what you're able to do with this package is outsource some of the admin and promotional work to enable your team to do what they're very good at, is working with their colleagues and teammates to share information and perhaps embark on a new way of working.
And reduce agency spend as well. Thank
you for whoever chipped that in. And I think this is the bit we're going to consider now actually is what this really means for you as organisations. So we can flip to the next slide if that's all right. Thanks, Lauren.
Sorry, Olivia, that was me. Can you click through to the next?
Oh, sorry. So while we're waiting for that, here we go. So apologies, I was going to try to sort these questions out separately yesterday, but I had some serious IT issues. But what I want to do now is just allow part of this session time to consider the steps around the pledge. So if you were going to appoint a health and wellbeing coordinator in your organisation or in your teams here in Leicester and Leicestershire, do you feel you have someone formally doing this already or informally? Who might be the ideal person to take that on? Just have probably 30 seconds to a minute just to make a note on the paper in front of you or on your screen, so that after this call you'll have done half the prep work on this process.
Feel free to put your comments in the chat as well. It'd be useful to hear how many of you already have somebody that you think could be a health and wellbeing coordinator.
Lauren, did you want to take over the slides?
I can't take over your slides, but I'll take over in a minute to put the Mentimeter up.
Okay.
Okay, so hopefully that's given you just a bit of thinking time. Who might that fall under? Who would embrace that? Who could be supported to do that really well? Who's talking to lots of people, even if they need new information about like the comments that are coming through. So one of the next things on the when you sign the pledge is to commit to management buy-in. And I want you to think about who might be the best person to raise that with your senior leadership team or management team. That may well be you as you're sitting on this call, but it may not be, depending on the role that you have. And I want to allow a little bit of time as well to think about, are there any challenges around that? I think, are we using the chat for this bit?
No, so I've got a Mentimeter, so I'll just request control and
okay.
I will bring up the word cloud. So for this, we are just going to need to put a new code in. So if you reload Mentimeter or exit and just put the fresh code in, which is 2975. And what this will do is we'll be able to visually see what everybody is typing. So again, it's anonymous, we won't be able to see who's put what, but it just gives us an idea of the general thoughts that you're having around some of the potential challenges that there might be with implementing the Wellbeing Pledge. So hopefully you can all get that up. If you're unable to use Mentimeter for whatever reason, please go ahead and put them in the chat. But you should be able to just reload your Mentimeter and put some comments in that way. Great, so we've already got a few already. What will happen is if people put the same thing, it will make that one bigger. So we'll know then. So so for example, at the moment, time's quite big. So I'm assuming a couple of people have probably wrote time. So we've had about 6 people that have put something so far. So if we just wait and give everyone an opportunity to put something, that'd be great.
Okay, that's brilliant. I'll let the last few.
I've just spotted someone's put free trial. I don't quite understand how that's sort of a challenge. I don't know whether maybe that person thinks that the pledge and stuff is a trial, but just to confirm, Ali, if somebody gets the does the pledge and that's as far as they go, that's a permanent, you can have that pledge, can't you? That's a permanent thing.
That's so right.
That's not a temporary trial. If you choose to just go as far as making the pledge, getting that badge, putting it on your website or your recruitment adverts, whatever, and just doing that element of the process and promoting the resources, that's a permanent offer. So you don't need to. I assume that I might be misunderstanding that comment, but
no, you're right. Bryony, do you want to add anything there?
Yeah, so it lasts for 2 years and then we ask you to renew it just to sort of re-demonstrate that commitment. But yeah, once you sign the pledge, you're recognised as a pledge signatory for the next 2 years.
Okay. So I think we've got most people's comments, Ali. So shall I move on to the next question?
Oh no, can you just leave it there?
Moving.
Okay.
Just to say, if I go off the slide and you carry on writing things, we'll still get them and we can still share the results.
Let's just reflect on that, because I think it's really important that what we've got come through. Time, obviously time was going to potentially come up for lots of things, but actually by having a ready-made process that's got things in place to help you, that means that it should be less time, and it's part of a journey as well. So we've got lots of information we'll share with you today by working out who the best people to start with start the conversations with may save you time. And also Brian and myself are working with a number of other organisations, so if there is a challenge that's coming up that you think is going to cause you an awful lot of time, then I think we need to think about that and work out if there's a different way of doing it. We've also got financial, well, the pledge, there's no cost to the pledge. The next step would be potentially a financial, but I think it's about considering if there's savings that are going to come through from that, and they probably far outweigh the cost, but we can also look at that one. And the communication, there's an awful lot of prepared resources that would help you communicate with staff, and the campaigns and information that come through are generally evidence-based campaigns. A lot of them are national campaigns, so some of the apathy and feedback from staff might be there initially, but I think when they start using the tools, so One You particularly, the resources are based on huge amounts of feedback across the country, across all age bands, demographic groups, and the wording would come back in a language that suits your age or personality and the things that you've said. So it's really interesting. I totally respect the feedback that's come, but I think some of the resources might address some of the challenges that are there that you've raised. So, but thank you for that. I think we'll use that in a bit, if that's all right, Lauren. So we had another question that coming up. I think that's a Mentimeter one as well, isn't it, Lauren? Here we go.
It is. So it's another word cloud, and that is what can be done to overcome this.
Is there anything that you could do that might reduce some of the challenges that you've shared? That's a good question that's come up in the chat. Could this count as responsive as CQC's eyes? Does anybody who would? I would hope that it would, but I would like somebody who's in your sector to perhaps answer that if they can.
Yeah, that's definitely something that we can speak to colleagues about, and certainly get an answer over about that. We do have Skills for Care colleagues on the call, but I think that's probably definitely something that we can go away and then come back with a response on.
Thanks, Lauren. Okay, we've got some great responses coming.
Yeah, I love that word collaborate, because I think that's what this is really about, isn't it? Because even within what you guys do, it's about collaborating, and you bring together a lot of different projects that are kind of already happening, like This Girl Can and all the. It's about collaboration, isn't it? About bringing all this together to make it easier and more streamlined for people.
Brilliant. So those comments are fabulous. The one at the top's made me smile, is to make time, because it's actually, if it's a priority and you've aligned time to it, you've got interested staff, communicating in different ways. We've got a response around sits across CQC well led, so that's helpful. Regular updates, teamwork, time management. I think that's really, really helpful. Are you able to save those responses, Lauren?
Yeah, I can, absolutely. So I'll make sure I get those across to everyone as well. And people should be able to keep continuing to respond, or of course put your thoughts in the chat. Absolutely.
Brilliant. Can we switch back to the slides then?
Yeah, hopefully Olivia will be able to get them back up.
Okay, so there was a next question really. So, but it's not necessarily a Mentimeter chat. Is what sort of method of communication do you use with your team? Is it emails? Is it WhatsApp? Is it your own app? Team meetings, texting? Sorry, back one slide. Because part of us being honest about how this is going to work is about the communication method that you use, and then it's for us to work together to make sure we've got information in a format that's easy to share, easy for people to receive. So I don't know if people want to put in the chat what sort of methods of communication you're using. Might start to come through, and I'm just aware of time, so I don't want to emails and phone. Great. So Brilliant. So I think Bryony already mentioned that most of the information is web-based. Even if we got to the workplace needs assessment, that's a survey link. So that's very easy to share via email and text and WhatsApp. So that's great. And notice boards, we've got posters as well. And I think we have to be honest about where people are ready to hear and see information. So that's really helpful. And just keep coming. Zoom, love it. Brilliant. And social media and Facebook's great because it enables everybody to group comment on images as well, and videos too. So that's excellent. So just a thought process, really. If you were going to kick off with the pledge, and you had a chance to roll out a topic to support your workforce, which topic might you run with first? And it's at the minute, obviously, it's based on your gut feeling and information that you know. But just have a think, because I think this is part of thinking where to start. Mental health and resilience up first, Bryony. So based on the pattern of responses so far, it sounds like you've already part the way down the process of where you might start, which is great. And also it's really important that you know it's your workforce and you know your workforce better than other people. So you may start with that and move on to something else, or you may stay with mental health and look at different aspects of that and things that impact and affect it. So thank you for doing that. I think that's really important thinking time that you've just spent time doing today that you probably don't need. You're off the starting blocks essentially. As and when you're ready to sign the pledge, you click on the link that we've got on the slide there. They're still coming through. Got physical health, mental health and wellbeing. It's great. And Lauren, if you just skip to the next slide, please. Brilliant. And then this is the last one really, is what would be the benefits of committing to support the health and wellbeing of your workforce now? Is this a Mentimeter one, Lauren, or are we just a discussion?
It's not a Mentimeter, no. So hopefully we can sort of put things in the chat. I think obviously you've covered some of the really sort of key benefits, but it'd be really interesting to hear if people's own reflections on for their particular workforce where it could sort of fit in and be really beneficial. So we've already got a few coming through. Retention absolutely is a key one. Laura's raised a really good point about how this can actually contribute to your recruitment in terms of getting the word out there that you care and you value and prioritise well-being and looking after staff.
And I think sometimes being able to show that you do that helps. And if you are doing the survey annually or every other year, that really shows that you're looking in depth at what your workforce are saying they need, and then putting appropriate actions in place. So I think that there is a support process here. You start with the pledge and then progress at the level that suits you, but just know that it's there because it will help prevent some things that come up. And actually, if recruitment and retention are major issues, this could really be a key player with this.
And also, just to add as well, the value, if we reflect on candidate referrals, the value of people talking about how their employers treat them. So this again would have a massive impact on the discussions that your workforce are having with potential employees of the future as well. Word of mouth is a massive contribution to the views of your organisations that you work for.
Brilliant. So we've got some amazing responses there. I think they're brilliant. And I think you've really thought all about how that affects your individual organisation right now. So you've got the information from us. I think that's pretty much all from us. Bryony, do you want to add anything else? We've got a few more bits, haven't we?
No, I think that's good. Really good ideas in there. So we were just going to sort of run through some just a bit of shared practice really on what other organisations have implemented over the last sort of couple of years that we've been delivering this programme. So different organisations take different approaches, and a lot of these have come out of that sort of workplace health needs assessment and the actions they've taken away from that. Some of the ideas that Lauren shared at the beginning that some of you have already been doing, so like engaging with National Fitness Day and campaigns like that are a great place to start, because all the resources are already there for you. So it's just engaging with those campaigns and those events that take place throughout the year, and they give you a good focus point for different areas of health and wellbeing as well. So there's Mental Health Week in May, World Mental Health Day's just been, so you can really jump on the back of those and take advantage of resources that already exist. But specifically across some of the organisations we've seen, some of them have pinpointed areas of priority. So for many, it's been sleep, and an action that they've taken away from that is supporting employees with mindfulness, with sleep hygiene, and encouraging them to take that step back at one point during the day and just giving some time for themselves. We've done some physical activity champion training. A lot of organisations have implemented health champions within their own organisations who actually implement those health and wellbeing initiatives, but also just champion the agenda within their workforce. Often it comes across really well from a peer or from a fellow colleague rather than being sort of told what to do. It's that culture and embedding that ethos across the workplace. Many engage in sort of walking or active travel weeks. So they put on campaigns for a day or a week a year where they really focus on one of those elements. So it might be trying to get as many staff as possible to choose an active way of travelling to work across a week or a couple of weeks. One of our organisations has implemented a whole calendar of health campaigns. So each month they featured a different area of health. So January might be an alcohol focus with Dry January. February could be physical activity, March mental health, and within that month they offer a range of different opportunities for staff to think about their health point of view, and that might be a simple newsletter at the start of the month with some hints and tips around how staff can look after their health in that way, or more specific sort of organised activities that take place as well. Some have taken on doing just a one-off sort of health and wellbeing day where staff are given the opportunity to try different taste sessions. Obviously, at the moment, that looks a bit different than perhaps we've delivered them in the past. But as an example, there's a system-wide for Leicestershire Partnership Trust Health and Wellbeing Day tomorrow for all of their staff, and that's taking place fully virtually. So there's some workshops, some online activity sessions, all taking place across the day tomorrow. So it is possible to do that in a different way, and people are adapting to those situations. We have an online activity tracker, which allows workplaces to set up sort of activity challenges and compete against each other in walking or general activity challenges. We ran quite a few through lockdown, and you can do that against other workplaces. So you could do it with all the employees that are involved today. You could do it as a bit of a competition between you or just within your own workplaces as well. And then there's just some specific feedback there at the bottom around sort of thinking more broadly and not just at smoking, alcohol, physical activity, but those wider health concerns that affect the staff that work for us. And a bit of quote there from one of our HR teams and one of the workplaces we've engaged with, that actually the needs assessment and thinking about it from that point of view gave them the tool to sort of raise more sensitive topics that affect a number of staff without it being a formal process of HR. So it just makes it that more friendlier way of approaching health concerns or health topics that affect staff across the board. So just going to sort of nearly finished, but just to point you in the direction of these are the resources that are available, which detail sort of everything we've talked about today, how you can get involved, how you can sign up, the wider Wellbeing at Work support package, which we haven't gone into too much detail today, but there is a wider offer available as well. So we'll share all of these resources with you via Lauren, and if you have any questions or want any further information, mine and Ali's contact details are in there too.
Perfect. Thank you so much, guys. I think because of time, what we'll do is we'll move along, and then we've got the Q&A session. So if there are any questions that do pop up, then we can obviously address them at that point. There's so much to reflect on, and thank you everyone who's been getting involved, commenting, and getting involved with the Mentimeter. I think one of the things that we really wanted to get across is that this is a real opportunity for us as a sector across Leicestershire to really celebrate and showcase all of the work that we do around ensuring and protecting the health and well-being of our staff. One thing that Ali didn't mention and Brian didn't mention is on their website they actually do upload the logos of any organisations that have got on board with the programme. And so this is an amazing opportunity for us to fill that page with lots of adult social care employers, and that sends out a really clear message that as a sector we're really committed and we prioritise the health and well-being of Mandy's joined in. Just mute your mic, Mandy. Perfect. That we really prioritise the health and well-being of our staff. So the more organisations that we can get signing up, getting on board with this pledge in whatever way that is, and doing it, you know, in a really meaningful way at your own pace, but we can get as many organisations and just send out that really clear message that adult social care employers, as we care about our staff and that we prioritise that. So that's definitely something that we wanted to highlight. I think we could talk about this for a long time, but I think we do need to move on. So if we can move on to the next. So we have got an amazing peer speaker. Can I just check that Anishka's on the call? I think.
Hi, yes I am.
So Anishka's not got any slides, so she's just going to really speak, and I won't say too much because I just want to give the platform to you, Anishka. But if you could just speak a little bit about what you guys have been doing at 360 Degrees Healthcare, and then we can move on to the Q&A panel, and maybe you can answer some questions that people might have about that.
Yeah, that's not a problem at all. Hi everyone, my name's Anushka. I'm the Development Officer for a domiciliary care company. So we provide care and support within people's own homes. We're based in the East Lancashire area, so kind of Pendle, Burnley, Accrington, Haslingden, and also Preston. So we're kind of across the board up north, as Lauren said. I just want to say thank you to Lauren, firstly, for inviting me. We have at 360 kind of realised that there was a real gap in kind of national and local guidance at the time, where we're looking back at March when COVID first appeared. So I'll tell you a bit about myself and about 360. So I've been a care and support worker for 360 for approximately 5 years. The last 2 years, I got promoted to be the development officer of the company. So as Ali and Bryony kind of discussed before, that kind of includes the health and well-being side of things and recruitment. So at the time of COVID, me specifically, as a care and support worker and someone that was working in a management position, kind of was really scared. I'm not going to lie. I was like, oh, what do we do? What's going to happen? If I feel scared, our staff are obviously going to feel scared. What we found at the beginning of COVID, it was very unknown. It's still very unknown as we're going through each government changes, especially Leicester. You've been quite a high tier throughout. Lancashire have as well. So we found that this was actually something that was really going to affect people's well-beings. It was affecting mine. I was coming to work on a daily basis. I was providing care and support, but I was also working within the office. And I was scared to work. I was scared to take this horrible virus, whatever it seems to be, back to my family, back to my house. And if I was feeling like this, obviously my staff were feeling like this. As a management point of view, I kind of had a sit down and a discussion with my registered manager and managing director and said, actually, we need to do something. We need to help people because I'm scared to leave my house on a daily basis. We're expecting our staff to keep providing care to these vulnerable people in society. However, at the moment, they're feeling vulnerable in themselves. And within that vulnerable workforce, like Ali and Bryony clearly stated, people then don't want to go to work. We're then having recruitment issues. We're then having sickness issues. I would have staff ring me at the beginning of COVID and say, they'd have a call at 8:30 in the morning. I'd get a phone call at 8:15 saying, I'm just about to leave my house, but I physically can't leave my front door. I am scared. I need help. So what we decided to do as an organisation, we put a risk assessment in place. The risk assessment was kind of, it follows points. So it's your general questions, kind of, are you scared? Is your mental health affecting you on a daily basis during COVID? But it also was just a casual chat with our staff. I know in the Menti earlier, people mentioned about collaborative working, and without that collaborative working, we don't have a successful workforce. We can't provide what we set out to provide. None of us went into care and support for the money. There's no money in it. We went to help people. We went to assist people. And if we can't assist the vulnerable in society, how are we supposed to assist our staff? So within our risk assessment, it was piloted within myself. So my registered manager and managing director sat down with me and we had honest conversation. What's the matter? Why are you feeling in low mood? And because I was in the management position, but also as a care and support worker, I could trust my managing director that this information would be kept within the organisation. I'm quite comfortable speaking about my issues. So I have a mum that's got mental health issues. I've also got a sister who's profoundly deaf. My dad has health conditions as well. So at the start of COVID, it really did affect me. I had a mum that was not currently working, which affected her kind of mental health, being bipolar anyway. So within the kind of risk assessment, we discussed what we could do as a management point of view to kind of help and assist people. So it was piloted with myself, but then moved on to every other member of staff. So first we started on the BAME community because we felt that within our organisation, they were the most vulnerable. And then we moved on to people that had asthma, any kind of lung diseases that were in the vulnerable category, as mentioned by the government. We undertook the assessment and our staff kind of fed back that they could trust us, mainly because I opened up about my experiences, but also I was also going out on care and support at the time and having these honest conversations with people about how I felt scared. So what we then looked at as a whole organisation, we thought, actually, why stop at this risk assessment? We've done it to tick a box. We've done it to make our staff happy, but what can we do as an extra? So we asked staff, we put it out to staff, what do you want us to do? We've got these risk assessments in front of us, but what do you want to come out from this? What do you want us to do? Be honest with us, speak to us, have a general conversation with us. And what our staff actually suggested was bubbles. So what we did as an organisation, we looked at the national guidelines, and at that place it was that we could each have a bubble, and this bubble was a bubble of support. So what we did, we've got approximately 67 members of staff. We split them all into different categories. So people that we felt kind of had the same issues. So whether it was those that were worried about taking COVID home to their family, whether it was those that have got asthma, So we had all these different types of bubbles. So then what we did, we set up regular Zoom meetings. Within the Zoom meetings, it was the individual bubbles. They could then speak openly about issues that they were having. They then felt more comfortable and part of a team. I'm not sure if everyone in our chat, if anyone is part of a domiciliary care and support company, but we're quite obviously widespread. So we have staff in the Burnley area, and then we have staff in the Preston area, which is, for those that don't know that location, it's a 40-minute drive. So sometimes our staff don't feel part of a team. So within these bubbles, they could associate with different staff members, get their points and their feelings across, but also make sure that they felt supported, not only by members of management, but other care and support workers. And it helped build that friendship, it helped build that trust. It helped for us as an organisation to see what we were doing wrong prior to COVID. Why weren't we looking at people's well-beings? We had sickness because of people's mental health, but we kind of weren't doing anything about it. So COVID gave us that push to actually make our staff feel more comfortable. I know earlier, Ali and Bryony kind of put a question out to say kind of why is well-being important? Why should we look at well-being? And for us, we're all about working in care. We're all about protecting the well-being of the vulnerable. So why are we not protecting the well-being of our staff? Why are we not looking at our staff and thinking, actually, you're the ones that are running our organisation. Without you, we would not be an organisation. We would not be able to do what we do. So by our bubbles, we then said to staff, do you think these bubbles are working? How often do you want to do the bubble? It was their bubble, not management bubble. It was something that they could kind of lean on. Some friendships were made, discussions were had. And also, as the tiers are changing and COVID is changing and differentiating, we're all under different, I know the whole of Lancashire at the moment is under tier 3. However, we then also, we've started introducing other people from our bubbles from different tiers. We like to get other people involved, whether it's guest speakers, whether it's those that just want someone to chat to. So we've also put the bubbles out in our client basis as well to see how that goes. But we find the well-being of our staff is extremely important. Like explained before, without our staff, we wouldn't have an organisation. We wouldn't be able to do what we do. So that's kind of what I wanted to speak about, really, just how important it is to communicate and to build trust with your staff. If a staff member feels happy, if their mental health, they feel comfortable enough talking to you or another staff member, they're more likely to feel more comfortable within their role. And we at 360 very much believe that it's a development process. I'm the development officer. I've worked my way into this role. We also like staff to want to work with me and also want to build our organisation, because like I said before, our organisation is not just about us. At a staffing level, our staff is the most vital thing. I could walk out and leave tomorrow, but someone else would still have to fulfil my role. And it's the same with our care and support workers. And my role is for me. The staff's role is for them. We at an organisation pretty much build our clientele as well around our staff. We would also sorry, I was just looking at the question. Yes, I would be happy to share my risk assessment and questionnaire. That's not a problem at all. I will email it to Lauren and hopefully she can email it across to everyone. So we as an organisation use that risk assessment on a daily basis, even when we're ringing staff just to ask them, just to have a general chat. Because we're lucky that we are a small organisation. We've got approximately 70 members of staff. We are lucky that we do hear from staff, whether it's via Zoom, whether it's via social media. We will hear from our staff on a weekly basis, so we can tell whether they're not feeling happy, whether they're feeling uncomfortable on a daily basis, and that they feel open enough to talk with us and have that honest conversation with us. So if you've got any questions about our risk assessment or our bubbles, I will be in the Q&A after. As explained to Liz, I will share the risk assessment and questionnaire. That's not a problem at all. But I think some key tips, if you are going to do the bubbles like what we've done, is make sure that they're consistent. Make sure that you're putting people in the bubble. We're quite lucky that we know our staff. We're on quite a one-to-one basis with our staff, like I said, on a weekly basis. So we could figure out who would work well together within the bubble. And that's quite a key tip. You don't want someone that's really quiet with a really, really loud person. We need people that would be able to work well together. Also, as kind of a key tip, our kind of risk assessment worked well and our bubbles worked well because, not to put a big head on, I was kind of the first pilot for it, and I was the one kind of doing the risk assessments with our staff. So yes.
Oh, sorry to interrupt. I'm just looked at the time. We're going to have to move on. But I know that we're going to have loads and loads of questions. Could I ask you just to keep an eye on the chat box and maybe answer any questions in there? Just 'cause I know lots of people are going to have lots of questions. Is that okay?
Yeah, that's not a problem. I was just actually on the last sentence.
Oh,
yeah,
sorry. Do you want to finish your sentence?
No, so our top tips were just basically to make sure that your staff feel comfortable in their bubble and make sure that you're open and honest with them and they'll be open and honest with you. But yeah, that's it.
Thank you so much. That was
no problem.
That was really, really useful, and I know that loads of people are going to have got some really good ideas from that. So thank you so much. It's great to bring people in from other areas of the country as well, and just to hear, and obviously, like you said, some of the same sort of experiences around sort of the tiers and the different sort of restrictions that both areas are facing. So that was great. If we could move on, my screen seems so. I won't talk too much about this because, like I said, we are a bit pushed for time, and I want to make sure that we can get through all the speakers that we have on the agenda. I just wanted to reflect a little bit on what we've heard so far and some of the really key points that have come out from what everyone so far has had to say. Obviously, sorry, my screen is, there we go. So one of the main things, and Anushka said it really, really well, is good communication. So that is absolutely vital, whether it's to do with the pledge, whether it's implementing bubbles, whatever you choose to do moving forward, it's key that you communicate with your staff, that you find out the best way to get information out, whether that's email or a Facebook group, WhatsApp group, whether that's ringing people up and having a chat, regular team meetings, whatever that is. Getting good channels of communication are absolutely vital to this. The other one is about having an open door policy and approachable management. And Anushka's kind of again said that really, really well around the reason that their strategies worked was because staff felt able to come and to be honest and to speak about what they're struggling with, what any concerns they have. So finding ways to make sure that staff feel like they can come and talk to you. Having a tailored approach, so we talk a lot about person-centered care, and we need to apply that to our staff and tailoring it, finding out, and that's why something like the risk assessment is really useful, because you can find out about that staff member and what they specifically need and what support you could put in place for them. Being proactive. So in the Wellbeing Pledge, we about the different resources and talked about the topics. And one of the things that Ali and Bryony sort of talked about when we were meeting and discussing this was that actually some of the topics are quite sensitive, and people might not want to come to you and say that they're struggling maybe with their alcohol consumption, or they'd like to learn a bit about weight management. There might be topics that they're really not comfortable talking about. So being proactive, sending out those resources, not waiting for people to present with challenges before you actually send that information out is really important. And then finally, and Anushka's kind of illustrated this wonderfully, is it's about trust and rapport. It's about building up that relationship with your staff. making sure that they know that they can come and talk to you, and that you're not going, you know, that you'll keep things confidential. So that's just some of the key points. We're going to move on now to the bit about so we've got Matthew Errington, who hopefully a lot of you do know, and Juliet Green, who are both on the line, and they're just going to quickly run through some of the resources that Skills for Care have, and some of the wider things that are happening both nationally and regionally. So I'm just going to hand over to Matt if he's on the call.
Hi everyone, hopefully most of you will know me and you're not going to be too distracted by the most adorable cat in the world as well on my camera. I'm the locality manager at Skills for Care that covers Leicestershire, Leicester and Rutland. So I have to know a bit of knowledge about all aspects of the Skills for Care work programme. And I also sit locally on the Leicestershire, Leicester, Rutland Health and Wellbeing board that covers the health and social care workforces. So we're just going to talk about some of the local, if you could go back, sorry Lauren, the local support groups, the peer-to-peer networking. We're also going to look at some of the work of the Health and Wellbeing Board and also the national work. So I'll introduce Juliet, and Juliet's going to introduce herself and take you through the national work.
Thanks, Matt. So really pleased to have the opportunity to chat about our national work. It's been so interesting hearing from our speakers so far. And some of what I'm going to say will resonate in what Ali and Bryony said earlier. And Anushka, listening to your personal and very sort of moving account, it's just so interesting to hear. So I'm up north too. I'm up in Greater Manchester, so we're in a tier 3 as well. And you know, it goes without saying that workforce health and wellbeing has just never been more important. I work with the Skills for Care team that leads on wellbeing. And we know stress and burnout are real issues for the sector, and it's been impacted by the pandemic challenges. The topic of wellbeing is so wide-ranging, so that at Skills for Care, we have an overarching wellbeing group that works across our national and local teams to really understand sector need and coordinate our work. And just from a strategic perspective, we've established a national group with partners. So that includes ADAS, LGA, National Care Forum. We're really pleased to welcome Anushka's going to be one of the representatives too from a provider perspective. And the group has a shared purpose to place wellbeing at the heart of providers, commissioners, regulators and policymakers, focusing on that importance of investment, leadership and culture. We know from our productivity research that a valued and engaged workforce that's supported with a health and wellbeing, it has, you know, there's improved job satisfaction, better quality care and a more productive workforce. And, you know, we listen to a range of initiatives that are happening up and down the country. So, you know, things that 360 healthcare that you've just been talking about, which are fantastic initiatives, compared to one owner saying that in a wellbeing discussion, I pay staff, why would I need to do anything more? And at that point, we usually get a bit of a sharp intake of breath. So our collective objectives strategically are to raise the value of wellbeing, why it's so important, using our networks, skills and influence, and to establish clear measures showing that investment in workforce wellbeing has a direct impact on care quality, on retention, sustainability and stability. So just one final thing before I just hand back to Matt, just a quick mention that we're conducting a survey with partners of the social care workforce around their access to wellbeing support and occupational health. We're going to use the feedback to help work out what needs to be done to improve and to share good practice. Survey opens tomorrow, and that can be accessed via our usual email bulletin and social media channels. And we're really, really positive about this work and hope that together we can make a difference. So Matt, back to you to talk about the local work.
Thank you, Juliet. Lauren, do you mind skipping on to the next slide? So first of all, I was going to talk about the peer-to-peer networking. So really important for managers to get to talk to other managers, but also talk about how they're supporting their staff team. So we have a Leicestershire, Leicester and Rutland registered manager network, which had been meeting weekly since March, but prior to that we used to meet bi-monthly and invite guest speakers along. The structure that we're following now is a monthly meeting with the first hour reserved for peer-to-peer support, so solely for managers or deputies if they're covering on sort of behalf of their manager, to come and share challenges, positive experiences, get support from other managers. That's going to be reserved for the first hour, and it will solely be managers present on the line, with the second hour then inviting guest speakers along based on what topics that you would like to hear about. So we recently did one on health and well-being. It's important to say that all of the intelligence and everything that gets fed back through that channel, it goes into a market intelligence report, which we then send on to Department of Health and Social Care on a weekly basis. The intelligence that I get from it, I take to the Leicestershire, Leicester and Rutland Health and Wellbeing Cell, and it can really influence things on a local and a national level. So I would encourage you to come along to those kind of things and to share experiences. That's specific to Leicester, Leicester and Rutland. There is an East Midlands wide deputy managers network, which has that peer-to-peer element support, but then also is about upskilling deputies. And then there's obviously the one for the learning disabilities providers as well. So they're very tailor-made for that service provision. If you could skip forward, Lauren. So since the pandemic, we introduced a advice line. So this is to support with anything that is part of the Skills for Care work programme, but wellbeing is part of that. So I thought it was important to include it in the slide deck. It's open office hours, and it's for anyone within the sector to contact, and it's got some ideas there around the kind of things that you would contact about. Obviously I'm a local contact, so if there's any questions that you have, you've also got me as a mechanism where you can get support from, or if you just want to vent or have a discussion about anything, then you can just let me know, or you can contact the National Advice Line. I've seen a question in the chat, Lauren. Afterwards I'll put my contact details in the chat as well, so people can contact me about joining registered manager networks. We also have a WhatsApp group that's associated with the registered manager network, which sometimes that's another good way of getting the peer-to-peer support. And there's also a Facebook group. So historically that was open just to members of Skills for Care, but currently any manager can join that group. So again, that's a really good way of getting the peer-to-peer support. You could skip on to the next slide. So these resources are all available on the website, and I've hyperlinked them in this slide. So instead of delving through our website, which has an awful lot of information, you can just click on the links. These were guides that were available pre-COVID. So the first one, the Building Your Own Resilience, looks at the resilience of registered managers and looking after self. The Building Resilience of Your Team, obviously self-explanatory. That's a guide that looks at supporting your staff group. And the Developing Resilience in Practice guide looks at very practical solutions from other providers around how they've used different health and wellbeing techniques in their services. So very similar to what Anushka was saying earlier, having case studies direct from provider settings. Also on the web page at the top, it has some links to e-learning on mindfulness and the Mental Health Foundation. If you could skip forward, please, Mum. So here is a list of all of the webinars that I think are related to health and well-being. So these are short 30-minute recorded webinars that are available on our website that we've been recording since the pandemic, and we'll continue to film more as things progress. But if any of those are of interest to you, then it's all linked in the website at the bottom. I'd encourage you to have a look. They are only short. If you could skip forward, Lauren. The next one that is related to wellbeing is on the 4th of November. Feel free to book on to join that live, but as I say, they are all recorded and they'll get put on the website afterwards. So this is Leading for Wellbeing, looking after your staff teams. This is part of the health and wellbeing cell. So as Bryony alluded to earlier, LPT have sort of led the discussions on setting up a health and wellbeing festival, but this is open for any staff member across LLR across our health and social care workforces. So in there, I've put the 2 documents. There is a prize draw linked to it, and there is a day program outline from anything from Zumba to there's all sorts of different things on there, but it runs all day tomorrow. If anyone is interested in that, I would say print out the program outline, share it with your staff teams, and let them join as and when they can. If you could skip forward. So these are the projects that are linked to the health and wellbeing cell, some of which are relevant for social care, some of which are more health orientated. The key things for me would be they're looking at setting across adult social care, so they want to make sure that the health and wellbeing messages get into staff on the front line. There are a whole host of things that are accessible for them, and they're worried that perhaps that message isn't always getting across. There is an appreciation and recognition project which I've been asked to lead on, so I will be engaging with Olivia to take a lead role in that, because a lot of the appreciation and recognition stuff has been thank you NHS, whereas actually we want to be celebrating social care as well as all other key workers. So there is going to be a programme of work around that. Obviously we talked about the Health and Wellbeing Day, and they also want to introduce a health and wellbeing induction for all new starters. So there is a slide deck that I can share with Olivia and Lauren, and they can send out. They do want comments about that. So if anyone has anything that they would like to link into that health and wellbeing cell, you can contact myself. I sit on the board. Also from a social care perspective, Olivia now joins the group, and Harj from MCare is also represented on the call. So any of us, if you've got anything to feed in that's related to health and wellbeing, please do let one of us know. We can skip on, please. This is all linked to the national offer and different apps and online platforms that are available to support. I'm not going to cover that in any great detail because you've probably seen it through the CARE app that was introduced earlier in the pandemic, but just a reminder of the mental health apps that are available to support. Skip forward. And same again, I'm not going to go into these in any great detail, but for any members of staff that do need support, whether that's Samaritans or hospice and coping with bereavement, then that is accessible for adult social care staff.
Great.
Yeah, Lauren, I'll wrap up there because I've been over the 5 minutes, and that's the last slide. The slides will be sent out afterwards, but just thank you everyone. I hope everyone is safe and well, and I'm always on hand to talk if you need a chat.
Thank you so much, and thank you to both Matt and Juliet for coming on and just giving some updates. And Matt's really helpfully put in all of the links there. You can also access this in the members area of the Inspired to Care website. If you don't know the passcode, just drop us an email and we'll happily give that to you. But we've got loads. There's a whole new section all about wellbeing where we'll be uploading these slides, the recording, loads of information. So just get in touch if you need help accessing that. I'm going to hand over to Olivia now. Unfortunately, like I've said in the chat, we have run behind. I think wellbeing, obviously, we've had so much engagement and questions, which has been fantastic. But I want to make sure that you can hear some of the latest news from Inspired to Care. If you do have any questions, please just put them in the chat box and I'll make sure that they all get answered. I'll follow them up and get back to you via email. So please go ahead and just put those questions in there, and I know that all the speakers will be happy to answer them. So I'm going to hand over to Olivia now, who's going to chat about some of the things happening with Inspired to Care.
Thank you so much, Lauren, and thank you very much to all of our guest speakers. What an informative session this has been. I personally myself have taken loads away from it, and I'm really excited about the different things that we can implement within our organisations to really support the workforce's well-being and looking outside the box on how it's going to really support you guys with your retention of your staff, so not helping with that constant revolving door of people coming and going from our organisations, and really having that change of perception really for people that, you know, are working within social care, and give us the recognition that we really do care about our staff and their well-being. So thank you so much for everybody that's attended today, and all the guest speakers. So big drum roll now, Lauren, because you've really hyped this up.
You hear that?
I'm really pleased to say that it's this time of year again where we are going to be, if it's going to work, it's going to be the Care Professional of the Year Awards for 2020. So we are delighted to say that we are working with Leicestershire Live and the Leicester Mercury again for a third year on the award ceremony for all of the care professionals that have worked so incredibly hard over the last year. So the big announcement was that the nominations are going to be opening from this Friday, which is really exciting. And I just wanted to give you a bit of a brief overview of how this year's awards are going to be different. So you'll first of all see that we've changed the title of it to reflect the professionals that you are. So usually it was the Care Awards. Now we're having it as the Care Professional of the Year Awards, and that's really, again, to change the perceptions that care is just a job. It's not actually just a job. You are all professionals. So we wanted to include that into the title this year. Nominations for categories are palliative care professional, supporting independence, residential community, dementia specialist, autism specialist, best newcomer to care, care leader of the year, special recognition, lifetime achievement award, and last but not least, the inspired to care member of the year. So I think you'll all be wondering, how on earth are you going to do a Care Awards this year? We are not allowed out of our homes. We've got the rule of 6 everywhere. So I'm really pleased to announce that we've changed the way that this award ceremony is going to be delivered this year, and it is going to be a completely virtual event, which is going to be able to be live streamed directly through to your services or the people that you support. And whereas last year there would be ticketed, you'd have to buy tickets to attend, this is going to be completely free for everybody to attend this year. It's going to be done live, where people who will be receiving awards will be have visitors to maybe places of work or where they live to give awards to, and we've had a look at some of the ideas that we've had, and we're really excited about it. Another thing that's going to be different, and I really want to stress this, is the nomination process is going to be much more accessible this year. So we want to really we want to commit basically to have more people that use services to actually give nominations as well, because I think it's really important for us as employers to, you know, nominate staff, and for staff then to, you know, nominate their employees. But what better way to get people involved, the people that use services involved, by actually celebrating the, you know, the professionals that have really supported and made massive impacts to their lives. So as well as having the nominations on the web page, there also is a PDF that can be downloaded and printed for people that use services to complete handwritten nominations if they decide that they want to do that. So I'm really pleased to say that it's going to be more accessible to those people that we offer support to as well. So more information is going to be coming out on that on Friday when nominations open. You'll get an email from us with all of the links, etc. And we'll also have a really good social media campaign that will run across our social media platforms, but also Leicestershire Live and the Leicester Mercury as well. I really want to celebrate this year. It's been horrific for most of us, and just hearing some of the absolute beautiful stories that I've heard about people going above and beyond, risking their own health and well-being in some cases to really support the people that, you know, that need it, the most vulnerable in our society. I think this year, you know, we want to make this a really big thanks really to all of you for all the hard work that you've done. Moving on, just quickly, I know that time's running out, so I'm just going to quickly skim across these. Most of you will have heard by now that we're doing the year-long programme of sector-based work academies, which has launched across the county. We've got first cohort of candidates actually completing their level 1s at the moment, and they should be completed by mid-November. So we would ask any employers that want to interview those candidates, please do let us know. The Kickstarter scheme, I haven't got much of an update on that, but I will come back to you next month on the Kickstarter scheme. Career pathways work is just to let you know, you'll again have emails from me that gives you a bit of an overview of this piece of work. We're looking at how we commission care across the county to really coincide with the strengths and that people have in the workforce. So looking at having career pathways in certain areas, including sort of autism, so and dementia and end of life and safeguarding and all those sorts of things. So we're doing a piece of research at the moment around that. So if you do get approached by the consultants, please do participate because it will steer that work. I won't go into the labour market update. One more thing that I wanted to speak about, I sent everybody an email, but it's just a quick reminder that Department of Health and Social Care have now made the care badge accessible to everybody. So if you haven't already, get on the website and order your care badges before they all run out. And then lastly, just a quick update from Naz. Naz, are you on the line from the LSCDG?
Hi Olivia, I'm here. I'll do a quick whistle-top tour. I have got some slides, but I'll just talk through because I think a lot of the information's been covered. I'm sure most of your members do know about Leicestershire Social Care Development Group. I will share these slides with Lauren so you can send these out. But we're here to support any adult social care provider across Leicester, and Rutland. Prior to COVID-19, we did have face-to-face training, but most of our training is now all digital or in a webinar format. So examples like safeguarding, moving handling, CQC best practice workshops. You can go to our website and just have a look, see what's available. You do need an account to join with us to view this on the learning management system. Again, I'll send that information out. So one of the things we did just in September, we carried out a bit of a survey around the digital content or webinars, and we had 65 providers responded. I'm just working out or looking through there and mapping out what providers have requested, see if we can try to come up with a short-term measure where I can just send that information out of what's available. And Matt's already sort of covered some of that in his sort of presentation, and the LSCG does work very closely with Skills for Care on that as well. Like I said, we do have some pre-recorded webinars around moving handling, safeguarding. I'll share you my email so you can get in touch with me. We do have e-learning, the Mental Capacity Act as an example, mental awareness, dementia, infection prevention control, and we've got some couple of specific learning engagement events around moving and handling and safeguarding. Again, I'll share them dates with you. There's 2 sessions in November, both covering moving, handling and safeguarding. We'll have some guest speakers there, and it'll just be an opportunity to come along and chat with the trainers, see how you're getting on, how you can share best practice. Olivia's already covered what we're currently looking at. The LSCG has commissioned the career pathways. So the organization is called Just Works Limited. So if you do get a call or an email, please do engage. We're also looking at or exploring whether the LSCG can become an endorsed training provider. So we'll let you know more about that. And I just want to mention the Workforce Development Fund that's on the Skills for Care website. Please do access that. I'm going to close it at that because I'm conscious it is over the sort of time allocated. I will share my slides. I will share my email as well. So if you have any questions, please just contact me and I'll be happily get in touch and go in further details about the LSEDG. Sorry, that's kind of rushed through, but
you, Naz.
hopefully that's been useful. All right.
Thank you very much, Naz.
Yeah.
I'll hand back over to Lauren now. Everybody, I'm sorry it's been a bit rushed at the end. I wanted to cover as much as I could, and I'm conscious that we're over 12 minutes over already, and I know that you've got busy days ahead. So thank you again from me for attending. Back over to you, Lauren.
Yeah, great. Yeah, just to say, we'll send out the slides. Thank you so much. Thank you to all of the speakers, Bryony, Ali, Anushka, Matt, Juliet, and Olivia and Naz as well. Thank you so much to everyone. It's been an amazing session. Thank you for engaging. We will send out all of the recordings and the slides. Please do get in touch if you have any further questions. And yeah, we will see you at the next event, which we will advertise. We will email out soon. So thank you, everyone. Bye.
Thanks all. Bye.